Welcome to the A.Little.Mental podcast, the place where you can find credible information, resources, and community to help you reach wellness a little mental at a time. I'm your host and founder, Morgan Reed, and I'm so glad you're here. Let's get into it. Dr. Kyle Schultz is a licensed clinical psychologist who has worked as a therapist, a lecturer, and an educator in various settings with a diverse array of people. He received his PsyD in clinical psychology and master's in human sexuality from Weiner University. Dr. Schultz joined the University of Pennsylvania in 2013 as a practicum seminar leader and joined as a faculty member in 2014. He teaches courses in advanced ethics, basic counseling skills, career counseling, counseling interventions, human sexuality, practicum, and sociocultural issues in counseling. In addition to working as a full-time lecturer in the professional counseling program, Dr. Schultz also owns his own psychotherapy practice, where he sees individuals with issues related to sexuality, anxiety, depression, eating disorders, and relationships. All right. So Dr. Schultz, thank you so much for being here today. I'm so excited for this conversation. But before we jump in, is there anything else you want to add some context or any additional information you want folks to know about you before we jump in?
First of all, I'm incredibly appreciative of being here. Thank you very much for asking me to join. I love doing these types of things because I think that one of the things I really appreciate is that because I teach full time, sometimes I think I have to remind myself sometimes that we have to figure out how best to connect with others who aren't necessarily master's level students or doctoral level students. And getting mental health out there to everyone, I think is such an important thing for all of us to really kind of think about. And so I love that you're doing this podcast. So
Thank you. Thank you so much. Well, very much on that subject, really wanting to dive into what goes on in a therapy session. Like, what if somebody has never experienced therapy? They may have their first time coming up, or they haven't been in therapy in a long time. What can they expect during a therapy session?
Yeah, sure. So I think first of all, a therapy session, I mean, in some ways it is just talking. And I put that in quotations because there's obviously a lot more that goes into it than just talking. But typically clients are going to encounter in the first few sessions of having therapy with someone, they're going to essentially kind of talk with them about some of the reasons that they're coming in. They're going to kind of try and give them a little bit of background. Most therapists want to know some degree of background of why the person's coming in. Some of them do pretty thorough, what we would call assessments, or asking a bunch of questions and trying to learn a lot. Some are a lot shorter. But in general, I think what clients are most likely going to encounter is someone asking them to talk about their thoughts, their feelings, and their behaviors. They're going to ask them to talk about significant moments in their week or in their past that they feel are related to the presenting problem that they're bringing in. And there's kind of an expectation in sessions that as clients and therapists or counselor, and I use therapist and counselor interchangeably, that the therapist and counselor are going to kind of work together both to kind of understand a person's thoughts, feelings, and behaviors, and then try to do something about it, both within session and oftentimes therapy will have a homework component. We often try to stay away from that term because no one likes homework, or people rarely like homework.
Right.
But typically people will take something with them from the session. And if they're seeing their therapist weekly, there will be things to practice or try in between each of those sessions.
Okay. So like you mentioned, when it comes to therapy sessions, there can be a variety of ways, right, that it can go, but mostly it's kind of addressing the issues that you're coming in with, which then warrants the self of you having to have a level of awareness, right? Like you may not know exactly what's wrong, but maybe something's wrong or something's going on that you want to address.
Yeah. Well, and one of the things I want to convey as well is that it's actually really common for people to come in and not actually be sure what's wrong. They just know that something's wrong. And people will typically say something to the effect of things are just not like they used to be. I'm not as happy, or I'm feeling more nervous or worried. I'm having more issues in my relationship with my partner or at work. I just know something's wrong. I don't know what it is or what to call it. And so one of the things that I would want to convey to any new client is that there's not supposed to be any pressure on them to have figured out their problem, what it is, and what to do about it. That's what therapy's for. And so clients help therapists by kind of talking about whatever it is they have related to this presenting problem. And there's no expectation, I think, to have a very clear linear story that makes sense. A very common thing I hear my own clients say is, I know this isn't rational, but this is what I feel. And I love hearing that because in some ways, it's a person kind of acknowledging, like, I have some of these things that are going on in my thoughts that I need to sort of figure out. And it's related to the emotional experience I'm having as well. So,
Yeah, that's really helpful, I think, to help set the expectations or lack thereof, really, for folks going in, that you don't have to have it figured out. That's the point of therapy,
yeah.
is to just have an idea of that something, like you said, something shifted, something's different, or there may be something I want to explore more. In terms of working with clients, how do you help set expectations in terms of what progress can look like, in terms of even what strategies you use to help them explore some of these thoughts and feelings and life circumstances? How do you help them recognize how you're helping them?
With every therapist, it's different how they do like their process. But with mine, I generally tell all of my clients that I'll generally meet with them for 2 or 3 sessions in the beginning. For the first 2 or 3 sessions, we're essentially going to talk about what brings them in to session and why they're here and what are some of the related issues that they might be having. I'm going to talk with them about their understanding of those issues and maybe even some of their beliefs as to why those issues are there. And again, sometimes they have ideas and sometimes they don't. And then typically in the first session, I let most of my clients talk. For a lot of folks who are just getting into therapy, especially for the very first time, there's a lot of stuff that they want to say. So I even teach students, like, give someone some space and just let them, whether they want to call it venting or sharing everything, let them go and encourage them to kind of tell their story.
Mm.
I'll generally use like a second session to do follow up questions for myself of things that I want to know in terms of what I think would be useful to know to help this person. And then around either the second or third session, we'll kind of have a conversation together about, like, how is it that we both understand what's going on and to some degree come to an agreement as to what might be causing some of the issues they're bringing in, and a proposed idea about like what we might do about it, both in session and out of session. And it's supposed to be a really collaborative process because in some ways, like, clients are the ones that are doing a lot of the work in terms of talking and doing some of the homework stuff outside of session. And so it's imperative that counselors and clients are kind of like in agreement about, again, what is the problem and what to do about it. And typically during that session, we're going to talk about like goals that a client has. And I generally try and recommend that clients kind of come up with some of their own goals so they get what it is they want. In a lot of cases, when clients are paying out of pocket, I don't like to think about them as consumers necessarily, but for some folks are paying a lot of money out of pocket and they don't have time to waste time. And so in some ways I encourage them to kind of be consumers in the sense that if they're paying for something, they should get within reason something that they're expecting from it.
Yeah.
There should be some agreement in that third session about what is possible. Now, if a client tells me, and I've had this happen before, I've had clients who come in who have had traumatic experiences happen to them, and they'll say something like, can you help me forget this traumatic experience? And that's not really possible. And I really empathize with someone who might want to do that. But, in that type of session, I might validate why someone would want to forget that, but also really help them to understand what's possible in terms
Mm.
of something like trauma. And so I also encourage all clients, even my own, to really kind of pay attention to, like, do I feel like I fit with this counselor? Do I feel like there's a connection? Do I feel like they get me? A lot of the research around outcomes or like how well therapy goes is directly related to how good of a relationship there is between a therapist and a client. And so, like, to me, that's paramount. It's so important to me that I will tell my own clients, please see one or two other therapists
Mm.
and go with the person that you feel good with. And that doesn't hurt my feelings. It shouldn't hurt other therapists' feelings because it's really about, at the end of the day, that connection. And I'll also generally tell folks, I can't promise anything. Generally, what I like to do is set an expectation that we'll check back in maybe in a month or two about how things are going, whether this is useful or not, what can we change, if anything. And most of the time it goes pretty well. And there's some things that can be tweaked a little bit. But every once in a while, there are sometimes clients that I work with where it's very clear that there's just not a good fit. Again, I don't see that as a bad thing because clients should find and be with therapists in which things are working. And again, for folks who are paying for this out of pocket, they need to get their money's worth. And so you don't waste time dealing with something like that.
Absolutely. And I love what I'm hearing about what you're saying when it comes to a therapeutic relationship, is that it is a dynamic, that there could be a bit of a power play there. or a power dynamic there, but really emphasizing and putting that onus on you as a therapist to ensure and re-emphasize that it is a collaborative space and that they absolutely do have control and say in how their treatment and how their progress is going and where to take it, because I
Sure.
think a lot of people think that they just come into therapy and they just give that all to the therapist, and it's totally on the therapist to decide where to go.
Yeah, and I think this is a cultural question too, because certain cultures have different beliefs about what counseling and therapy is. And so, with some cultures, like there is the expectation that a therapist will tell them what to do and be very direct and very advice giving, which in other cultures is actually considered pretty taboo. And so you want to kind of think about how what is it that I'm actually looking for from this person, and how is it that I can kind of get them. And one of the things, and again, this is a cultural piece as well, is there is understandably a there's kind of a allowing the therapist to kind of take the reins essentially because they're the professional. And I get that. And it makes sense in some ways, but also like I think sometimes clients feel then disempowered if something doesn't feel right, or they're more likely to put it on themselves that something's wrong rather than like if something goes wrong in the first few sessions and it doesn't feel good. Yeah, it's important to determine like, is it not feeling good because I'm being pushed in a way that like I need to be pushed, or is it not feeling good because maybe this is really not a right fit?
How do you, because I know you've worked with a lot of different populations, a lot of different types of clients. And again, like you said, and I really appreciate that you named this, is that culturally, how you go about approaching different clients could vary. But
Oh
how do
yeah.
you make folks feel safe? Like with this variety, especially in the beginning or even in the middle, when you're well into the therapeutic relationship or even building it, how do you make your clients feel safe enough to get further along, to get into those deeper, more vulnerable spaces that they may be kind of skirting around or only maybe like summarizing in those first few sessions?
Yeah, well, and I see it as kind of two different questions. One being related to culture, and one being related to kind of challenging clients. So I think I'll address them in that order. And then, first of all, I think at least related to culture, clients. One of the fortunate or unfortunate things related to counseling is the phrase "it depends," because it really depends on every single client. So, first of all, I work with a lot of queer clients. So gay men, lesbian women, bisexual people, polyamorous people, pansexual people, trans folks, gender nonconforming folks, gender non-binary folks. And so among the clients that I seek, it's really common for folks to seek me out specifically because I am a gay man, whether it's because I'm cisgender or not, like that's something that clients seek me out specifically because of that. For others of them, it's not specifically because I'm a gay man per se, but because I have the knowledge of that culture. And I've had clients call me, and I'll never forget a client that I called who asked me, he's like, I had three questions for you before I'm even willing to consider working with you. Which I love that sort of assertive, I'll determine whether we're working together or not.
I have a list.
And it was a really off-putting question because it was such a direct question. But the first question he had, and this was in just after the 2020 election, and he had said, first of all, who won the presidential election? And at the time, and even still, that is a question that is really inflammatory for some people. For others, it's a very clear answer. The person who's in office clearly won. But it was one of those moments where, that was really important to him. He also asked me, have I ever lived in a rural area? Which was again such a specific question, but I could tell that it was important. And as someone who
Mm.
grew up in a very rural area, I said yes. And he said, and then the third question was, have you ever worked with bisexual people? And at that point I had. And so for him, like he's a good example of someone who had very specific needs regarding like a cultural competency around politics, geographical location, and sexual orientation. And so, and I've had other clients who, that's not an issue. And so I also work with cisgender heterosexual folks who never bring up those things, and it's not really a question for them. And so, like I said, it depends on the person who's coming in.
Well, I love that prospective client of yours who came in with those three questions. Those are beautiful questions and valid questions. And I appreciate you naming that you appreciated the
Oh
fact
yeah.
that they came in, right? Like a good therapist should want you to come in with as much as you possibly can. If you do have preferences, to vocalize them and put them at the forefront of the conversation so that way they can best address it, like you said. And again, a good ethical therapist will say, I don't believe that this is the best fit, and walk that out with you. And like you said, or encourage you to look at other spaces, or like you said, they may align, and that may then begin, the workings and the beginnings of a really great, therapeutic relationship.
I think that one of the things that is really beneficial for me as a therapist is when clients come in and will say anything that is on their mind. That client is a good example of someone who was really assertive and put it out there, because the more you give me, the more I have to work with. And so sometimes clients will come in at the end of the first session. I just was working with someone a few weeks ago after a first session, and he said to me at the very end, "Oh my God, I'm so sorry. I was speaking so much. I didn't even allow you time to ask questions or what have you." And I said, "No, that is really helpful. Like, you've just told me many of the things that you think of as important rather than me trying to tell you what is important. And so
Mhm.
the more you can tell me, the better." And with that said, there are definitely clients who come in who are really anxious and nervous, and I have no problem with that. And so in working with them, it requires a therapist to be flexible and able to tolerate that maybe some clients will need to take their time, and a good therapist will be okay with that. They'll recognize that a new client is nervous, anxious, maybe not as ready or as quick to open up, and they give them a little space.
Mhm.
And that in and of itself builds that trust. But to the second question you were asking about, challenging a client to open up, like, it's like, I think that it is difficult because, first of all, every person is different on how much they're willing to open up and how much they're willing to share. I think that it has to do with clients pushing themselves a little bit, and they know themselves better than we do. Even at the end of therapy, they still know themselves better. And so I'll even share with clients, like, I want them to kind of push themselves in a way that they feel comfortable but not overwhelmed. Part of my role as a therapist is to push them a little bit as well. And it's this process that can be really beautiful when it goes well. Like when people push themselves and they get vulnerable and they share and talk about and process things that maybe they've never shared and talked about, that is a beautiful thing to watch. Sometimes it goes a little clunky. As someone who can be a little bit more direct and probably more like, having had me as a instructor, I'm sure that that I can have some expectations. And so that's something I know that I have to kind of keep in mind. And there's definitely been times that that's gotten me into trouble, in the sense that, like, some clients aren't ready to go that fast. And it's
Sure.
important for me to try and recognize I have to, like, push the brakes a little bit and slow down.
Absolutely. And I appreciate you naming that. Like, you recognize that that is something about yourself that is about fit, right? Like, some folks like the direct route. Like, I'm somebody who does like directness. I like to be confronted head on, and other folks either like to be eased into it or like to be kind of navigated to certain realizations in
Yeah.
certain time frames. But getting more into how you determine that strategy and how you gauge that, a little bit more into your personal therapeutic approach. I know we had conversations back when I was in grad school around psychoanalysis and how that, just as a therapeutic approach, has developed, and how that's something that, you've studied and
Yeah.
that you have definitely kind of integrated into your own personal practices and interventions and things like that. So I was wondering if you could give some more information around your specific practices, or how you try to go about helping your clients and your specific approach.
Psychoanalysis, I think, is more often associated with Freud and kind of like this antiquated cisgender straight white guy who made all of these proclamations about psychology that were very, very specific and for a very specific subset of people. Yeah, that's true in some senses. But one of the things I think that people don't know and recognize is that psychoanalysis has developed since Freud's day. And one of the enduring things that is most relevant to what psychoanalysis is helping people learn about themselves. So even when my clients ask me, like, well, what is it that you're going to do? Like, what is your approach? I say the way that I think about my work is helping you to understand your mind, how you think, how you feel, and how you behave. And what is very typical of a psychoanalytic approach is the idea that insight, or again, learning about how we think, feel, and behave, is one of the most important things in terms of making changes in our life. And so I really firmly believe that I can't ask my clients to change things unless they understand, first of all, what they're changing and why they're changing it and what the best way to change it is. And a psychoanalytic approach, I think, is also really known for talking about the past and connecting it with the present and the future. And rightfully so, it gets critiqued by some practitioners who really focus too much on the past. And so one of the things I say to my clients is that, my goal is to help you understand how the person you are today is influenced by your past and how to like use that to your benefit to grow and move forward.
I think that's a great, beautiful way to describe it. Like you said, if you've taken like an intro to psychology course, a Psych 101 course, Freud is the person that everybody, kind of just like gathers around, like, get a load of this guy. Like, what was he
Yeah,
doing here?
they love to make fun of him, and it's easy. Like some of the stuff that he talks about is really wild, and
So, yeah.
it's a very easy thing to make fun of. But one of the things that people don't know is that the current practice of psychoanalytic psychotherapy is empirically supported treatment. Like there is research evidence that supports that it's effective for things like depression, anxiety disorders, personality disorders, and when compared with other approaches, for the most part, it does comparably when they compare how people do in different theoretical approaches.
Yeah, and I appreciate you naming that there is empirical research, one for therapy in general, but for
Yeah,
the specific approaches and kind of getting more into your teacher professor hat.
yeah,
If there was a way, if you feel like there's a way that you could differentiate like that psychoanalysis point of view and approach in terms of maybe what other options there are as you're looking at different types of therapists
yeah,
that
sure.
don't necessarily overwhelm folks because there are a lot of different approaches, but
Yeah.
there are some like main schools of thought, right? In terms of like, I want a therapist who does take a look at my past as opposed to, I don't want to talk anything about my past. I'm here,
Oh
I'm
yeah.
now, and I want to figure out what's going on. And I don't need to touch that, like in terms of just differentiating those.
Yeah, sure. So I think from a psychoanalytic approach tends to be a little bit longer term, and when I say longer term, I mean like maybe 6 months to a year, if not more. This is contrasted with something like what would be called cognitive behavioral therapy, which is a short term approach. Short term approaches tend to be less than 3 to 6 months, and that tends to be a relevant thing for some folks because, again, related to finances or just ability to be able to attend therapy, like that can be a significant component. Psychoanalytic ideas, like I said, is really about helping people develop understanding and contrasting that with other approaches that are really about helping people develop tools and skills. These are two technically different things that, if you go to a psychoanalytic therapist, they're really going to focus on helping you understand yourself. There's not going to be a lot of direction on their part. It's going to be more client centered, I would say. And it's kind of up to the client to talk about things that are relevant and important to them, and then it's the therapist's job to essentially kind of help them become more acquainted with their unconscious thoughts or things that they're not aware of related to their thoughts, feelings, and behaviors. Whereas something like cognitive behavioral therapy, which is an effective approach to working with clients, it has a lot of empirical research as well, tends to be short term, very directive, and oftentimes there's very specific things you're supposed to talk about that the therapist will let you know, like, this is what we're doing today for this specific treatment approach. And it tends to be a lot more coping skills, problem solving oriented, which, again, useful, but not always what everyone wants or needs.
That was so helpful. I think, like you said, differentiating those two kind of schools of thought, or like cognitive behavioral therapy or CBT, is
Yeah.
definitely more of a structure, which, like you said, for some folks is great because they're like, I have a very specific problem and I need to address it, or how to deal with it, or how to cope with it. And this is kind of the lane that we stay in versus psychoanalysis, psychodynamic therapy is more so understanding like you said, the motivations and behaviors so that you then, as you move forward, kind of raising awareness of what you're doing and why and where that comes from.
Yeah, and one of the things that, is part of the psychoanalytic way of thinking is that once I understand myself and my problems, like then I'm much freer to do something about them. And so, like psychoanalysis, I think, and psychoanalytic psychotherapy will often kind of talk about as you get to know yourself more and more, you have a lot more freedom regarding your thoughts, feelings, and behaviors because you just know yourself better.
Looking towards getting back to kind of like how therapy sessions work and stepping a bit back in terms of more broadly how therapy sessions work. Can you explain like a doorknob moment and how you go about addressing that?
Yeah, sure. So a doorknob moment is essentially this is more of a clinical wisdom. Like this is something that's passed down from therapist generation to generation, and that we all observe this in our sessions. And a doorknob comment is essentially when I'm working with a client who, in the very last minute or two of a session, will bring up something really important, very explosive, very something that is really kind of it's the drama. It's the emotional drama of the session that they bring up
Yeah.
in the last minute or two. The reason, from a psychoanalytic perspective, that people do this is if I can bring up this thing that's really difficult for me to talk about, but I can leave in 1 minute or 2 minutes because it's the end of the session, then I can kind of address this thing, but not have to tolerate all of the feelings that come with it. And it's so interesting to watch how people really kind of struggle with an issue and need to take some time to be comfortable with it. And like that is every client, and clients who don't make doorknob comments work through their own discomfort or anxiety talking about things in their own way as well. So there's no right or wrong way to do it. And I just sort of see it as this person's very brave attempt still to talk about it. I don't see it as a bad thing because they actually still talk about it. I have clients who will not share things with me for like 3 months into treatment and all of a sudden tell me something that I'm like, I would have loved to have heard about this in the first 2 or 3 sessions, but that's how the unconscious works. And in some ways, sometimes people just aren't ready to talk about something, and they're not even aware that they're not talking about it until. And it's been really common doing longer term work where people say, like I said, 6 months in, oh yeah, I can't believe I never told you this, and like I don't. There's a reason why they don't tell me, and it's not something they're consciously aware of. So I just see it as how all of our minds work.
Yeah, I love you naming that from, again, the psychoanalytic perspective of like subconsciously, unconsciously, you did not want to address this, or you wanted
Yeah,
to have control around how you addressed it and in what time frame. So you didn't
yeah,
have to
totally.
talk it out. And I also love that you also broaden it to it's not necessarily just those moments of like when the therapist says, "Was there anything else that you want to talk about?" And you're like, "Oh yeah, by the way." But it also can be a underlying dynamic of you not naming, maybe even the biggest thing that you're there for. You and I've named this before where I've been with my therapist for years now where I brought something up as like the original reason I came to therapy. And while we've addressed other things, he was like, time out. That's the reason we started this whole thing in the first place. Why did it take so long for that to come back around? And then we talk about that,
Yeah,
about why it was a doorknob topic. Like I did not, it just unconsciously, subconsciously, it was one of those like, oh, I forgot, or it just didn't seem as important and walking that out.
yeah. And my hope in those moments is that all therapists don't convey to a client that they've done something wrong because it's not wrong. And actually, I view it as I used the word brave earlier. That like it's a brave thing to do. The fact that you actually took that step to talk about it, even if it was really difficult and you needed to leave the session, you took the step. We don't have to focus on you having done it right. And let's say someone makes multiple doorknob comments over the course of our work together, let's say in the span of 3 months, let's say they do it like 4 or 5 times. As
Mhm.
a therapist, I'm going to gently bring up at the beginning of a new session, like, hey, I noticed this as a pattern of something that happens, and no judgment, no criticism, but like, let's talk about why this happens and what it means.
Yeah, I really appreciate that you name that distinction too, right? Like it also depends on one, it's never a wrong thing. It should never be conveyed as a wrong or bad thing because there's always a reasoning and again, underlying motivation and behavior behind it. And your therapist, hopefully at that point in time, can navigate how to address it with you, whether it's gently, whether it's encouragingly, or like I mentioned, like my therapist and I have known each other in a lot of different spaces and he knows I am trained as a therapist. So he's like, like what's, like in that kidding way of like,
And
okay.
and I like that because it also exemplifies what therapy can be. It can actually be fun. It can be
Right.
playful. And yes, it's very serious at times and you're talking about very vulnerable things, but like some of my best work with clients is because we play back and forth with something and that becomes a way for us to talk about something that actually could be really difficult for
Yeah.
them to grapple
Yeah, like the laughing, the joking, the dark
with.
humor, like having somebody who can vibe with you off of that. All again, like you said, it builds that relationship, it builds that dynamic. And if it gives you a better and more palatable access point to actually talking about it, having a therapist that can kind of roll with those
Yeah.
vibes with you makes it that much more of a safer and more comfortable environment.
Yeah, and I think that is one of the benefits of longer term work is that you get to know your therapist a lot better, and they get to know you a lot better. I've been working with a guy for a few years now, and we were recently talking about his attraction to another person and his asking them out. And I knew that he asked that person out, but he came into the next session and said, "Oh, I'm not really sure what we should talk about today. We could talk about," and he listed something else, and he was barely smiling when he was saying it. I said, "What are you talking about? Like, we're not going to talk about this from
So
last."
we're not about to talk about the thing that we all
Yeah.
clearly want to talk about.
And he laughed and I laughed, and we both knew because we knew each other that we were both, without saying and identifying, he was feeling really anxious about that it was a big deal, that he was struggling to talk about it. But we didn't have to, I wasn't going to call him out. I wasn't going to tell him, "Hey, next time start off your session by telling me," like, no, that's not how that works.
Yeah, I really do love that you name that and normalize that, right? Like it's okay if you don't know how to articulate it, if you don't know when to bring it up or even how to bring it up. That's the whole point of the process is to try. Just even if it has to be like, by the way, such and such happened, okay, bye. Like the fact that you got to name it is
Well,
something that we're gonna celebrate.
yeah. And they'll come back. Like, it's
We'll
not like
circle back.
like I don't think it's ever happened to me that someone has doorknob commented me and then never come back.
Showed up.
That's never happened. So we'll get to it.
Yeah, and then actually maybe like kind of winding down in terms of after a session. Like you said, sessions can vary in terms of feeling, in terms of emotions you may feel throughout it. How do you suggest folks who may just be experiencing or starting out in therapy to take care of themselves, to deal with after session and how that all kind of can work?
Yeah, sure. So one of the things I talk with my own clients about is like, if you want me to give you homework or if you want us to come up with homework together, we can talk about that. And we can take like the last 5 or 10 minutes of the session. And I'll generally say to a client, like, "Okay, you tell me what you think of as like the 2 or 3 biggest points that you learned or took away or think is important from the session. And then let's talk together about like what you might do between now and next week when we meet." I tend to see people on a weekly basis. And we can kind of look at what, if anything, you can do between now and next week. Some of the clients that come in are really motivated and they want that homework and they want to do it, like they want the homework. Others are like, "I don't really want homework. Like, I look at therapy as a place for me to kind of process that stuff in session. And like, I don't want or need homework." Even those folks, I still think it's important that they do a similar process of identifying, like, what am I learning from this? And then how do I put that into practice in my life? And yeah, sometimes I think that therapy sessions can be difficult. And so it is important to kind of think about, well, what am I doing after my therapy sessions? When are they scheduled? Like, I have clients, because I see people through telehealth, I have clients who are going to work right after our sessions. And so for them, sometimes they need to take their lunch break after, or take a bathroom break, or take something that allows them to kind of button up a little bit more. Like, because people, especially if you're doing a therapy session in the middle of the workday, you get really vulnerable and sometimes you get really emotional, which is totally fine. But you need to be back on your game at work. And so sometimes you just need maybe a pep talk in the bathroom or a closed office door for an hour for you to off ramp, if you will.
Absolutely. Yeah, I appreciate you naming that. It could vary, right? Like it could vary in how a session can end. It can either be around taking those last 5 or 10 minutes to figuring out what you're doing in between sessions,
Yeah.
which I think is oftentimes an underrated part of therapy, right? Is the in between time. So you naming that, like whether you have homework or not, what you should think about or not. And then the immediate after effects and how that can affect and impact the rest of your day, and how where you place your therapy session in your day is something to consider as you're also going through therapy.
Yeah. That's good. Yeah. Great.
Well, is there anything else before we kind of close out here? Is there anything else you want folks to know about therapy, about going into a therapy session, or one important piece you feel like they should really take away?
This has been an issue, I think, ongoing, and it's something that I think is a barrier to access to therapy. Is that I don't think that people recognize that it takes some time to get into therapy, and this is something I hear from clients. This is something I hear from students. This is something I hear from friends. like when they're looking for a therapist, it can sometimes take a long time. And so my recommendation to folks, if they're considering it, is to not wait until, things are really on fire to start looking for a therapist, but maybe preemptively start that process if they know things are not going well for them, because it can take a while to find someone who takes the insurance that you take or who will take the fee that you're able to pay out of pocket. It can take time finding a person who's the right fit. So like I said, if I'm encouraging my clients to see one or two other therapists, that means for their therapy to really get started, it's going to take, even on top of that, a few weeks maybe to really kind of find someone that they fit with. So start that process early.
Absolutely. I thank you for naming that, of getting and trying at least to start looking for a therapist, ideally before you really need one. I kind of name, like, it's nice to already have like a general practitioner or like a doctor before you have like the flu, or before you
Yeah,
like
yeah,
break your leg. Like, you don't want to have to necessarily look for someone when you're already in pain, when you're
that's a good
already
point.
dealing with something. You would like to, at least, even if you don't necessarily use them or take advantage of them as much, it is helpful to try to get out in front of it as much as possible, because finding a therapist and the therapeutic process in and of itself is just that, a process. So it's not a one hit sort of deal. It's going to take some time.
Yeah, well put.
Amazing. Well, thank you, Dr. Schultz, so much for being here today. If you all would like to learn more about Dr. Schultz and his practice, we will have that information in the show notes. If you would like to learn more about where to find a therapist, how to find a therapist, you can go to our website, A.Little.Mental.org. And you can also follow us on social media on Instagram, TikTok, and Facebook at A.Little.Mental. Thank you so much for being here. And don't forget to take care of yourself today.